Hi, guys, and welcome back to the Backstage Bikini Podcast with your host, Grace and Jade. And for today's episode, we have none other than Cory Hagemann on the podcast. Very, very highly anticipated guest who Jade and I both really, really admire because she is a leading educator within the industry, J3U online coach, IFBB pro, nursing student, and she just also mentioned that she has a degree in videography. So she has it all, really. But we are absolutely buzzing to have her on the podcast. And I suppose, Cory, do you want to introduce yourself to all the guests? Let us know how you got involved in the industry, into competing, your journey to IFBB Pro, and I suppose where your passion for education came from and coaching and all that kind of thing.
Yeah, no, thank you so much. I really appreciate that intro. And I'll just for clarity, I don't have a degree in videography, but I wish I did. Honestly, I wish I'd gone to school for that because I feel like just that craft is something I'm so passionate about. But I did work for several years in like cinematography, working with different fitness apps. And for listeners, we logged on and I was still troubleshooting a few things and getting everything perfect so that the quality was all there, because I was so excited to finally come on this show. But thank you again for the intro. Yeah, so I think simply put, like I have always had a passion for understanding the why behind what we do in bodybuilding. I've never been someone to really just blindly listen. And I think as a female athlete, it is really important to be able to, understand, the guidance that you're getting, where it's coming from, and whether or not the person giving it really has your best interest at heart. So, I mean, like that isn't limited to PEDs. It's not limited to nutrition. I mean, like really with bodybuilding, we put so much time into this sport and it's a huge emotional investment, which I know from a coach's perspective, like you see this with your clients and, clients, you feel that like working with the coach when that synergy is there. So my start in bodybuilding, I mean, it was 2014 and I really wanted to gain more control over my approach to nutrition, to training. And I think we briefly discussing like just our experiences in the sport. I think it's easy to jump into something, get excited and think, okay, well, this is how everyone's doing it. So this must be the standard. And I absolutely believe that, there's definitely a right and there's an optimal way to do something. However, back then, I mean, 2014, 2015, we didn't have a lot of female specific guidance. And even when it came to how we dieted, it was very much one of those things like you were dieted like men very similarly, just much, much, much less. And I really wanted to challenge that. Lane Norton, he was one of the earliest influences in bodybuilding for me. And honestly, just being able to see how he went against the grain, I mean, that made a huge impact on my entry into bodybuilding. So I actually got into the sport coaching myself for my first show. And I mean, the expectations were really just like make it to stage and do it in this way that is, just simply put, just is different than how everyone else is doing it, is, sustainable and just a little healthier. I think at the time, like we could still get away with saying that. So now where that's led me, I mean, that first initial entry, in the sport integrated, I'm an IFBB pro. I turned pro in 2021. And honestly, I think I see myself continuing to compete, but I've really kind of come into this role as an educator. And I mean, you guys know, but listeners might not know, I'm a coach for John Jewett in a part of his university, J3U. And I mean, truly, I can't speak highly enough about it. It has been a huge, huge impact and tool to help me facilitate my learning. And I mean, really, when it comes down to it, that is what I'm passionate about, is understanding what we're doing, understanding why we're doing it. And I think right now we just don't have that representation as female athletes, specifically around the enhancement side. And we see over the years, things have progressed and it's become more important that we're not just winging it, and we're not just going into a prep or going into a coaching relationship just hoping that this person actually has our best interest at heart. So I know it's a little long, but I think that kind of gives a good summary. That's not a novel.
No, that's amazing. I think, like, listening to that, Grace, you might agree, like, coming into our first exposure, even as an amateur, into bikini was very, very, I'd go as far as to say ill-informed. Like, I certainly didn't have access to that amount of information, and I couldn't possibly have dreamt of not only entering the sport, but then taking the reins for that sort of first prep myself. What was it that armored you in order to do that? What part of your background, Cory, gave you that sort of confidence, I suppose?
That's a great question. I started tracking calories and macros really in high school. So when I made that transition to decide, hey, I want to start bodybuilding, it really came from a place of having tracked and having seen, okay, even if I'm not doing everything correctly, I am seeing results, and they are very directly related to, okay, it's because you're making these manipulations with nutrition. And that in itself, I mean, became really motivating. It empowered me. It gave me a lot of confidence around my ability to want to do something and to just make it happen. Now, why I got into that, I mean, like, I think listeners can relate, like all teenage girls, I mean, there's some type of dysregulated behavior, maybe with food. And I was in an environment where it was heavily pushed, you know, you need to be in shape. If you get heavier, if your composition changes, you are not as valuable. And I'll just use valuable, but like, I mean, that is something that is very commonly felt, I think, amongst females in general. So I really wanted to figure out, okay, well, hey, if this works off stage, why wouldn't it work getting to stage? I mean, like, we're talking bikini. This isn't one of the other divisions where the muscularity requirements is so much greater. I mean, this is realistic. And I mean, I was 18 at the time. So I mean, like, I had some muscularity, but I wasn't trying to achieve a physique that was 5-10 years down the road. At least at the time, I think the standard for bikini was a little different. And now I think if I was starting at 18 years old, if I was 120 pounds, I would be looking at a bigger commitment. It would be a little trickier to navigate.
I love that. I think your eagerness to ask the questions is so important, because I think a lot of the time people can be ignorant and or maybe just like shut things off, or might not want to know, I suppose, the deeper reasoning behind things. And I suppose when it comes to, because you spoke about there, like the enhancement side of things, and you know, your content is very heavily focused around PEDs, but where did your passion for learning about the kind of pharmacology side of things come from? I suppose the passion to want to educate other females, and in particular bikini athletes, on that very thing.
That largely came from realizing that if I'm going to take these risks, I need to be informed, and they're not small risks. And some of them, I mean, I can be a little dramatic. I really looked at all PEDs as like, hey, I don't have enough education around this. I don't like I don't like that feeling of being dependent on a coach or even someone, you know, someone I respect. I still wanted to feel very autonomous. And I think there's a huge carryover there from the dieting side of my background, where it was like, okay, I don't want to pay someone. I don't want to pay someone to starve me. I don't need to pay someone $1,000 to put me in 900 calories, tell me to do 2 hours of cardio a day. Like I can do that. Like I've been disordered. It's okay. With PEDs, it was kind of the same thing. It was like, I hear about side effects. I hear about other people's experience. And it sounds terrifying. And depending on who is talking about it, I mean, some people have really positive experiences and they're like, it's what is required. I've never experienced side effects. But when you actually talk with them and you actually dig a little deeper, or maybe you wait a little bit of time, you start to realize that they themselves were looking at it through rose-colored glasses. And from there, it's like, okay, well, there has got to be some truth to the negatives. And I mean, that's not even really getting into like the health outcomes. That's just like, hey, aesthetically, here is what you're committing to, and here's the assumed risk. And I mean, like my first year at university, I took econ, and I remember like the lesson on like opportunity cost. And I was thinking, I'm like, man, like we're in this sport that, you know, we're in the least muscular division, the least the conditioning requirement is the lowest, inversely the highest body fat, but we are we're considering taking things that men take. Okay, there's a disconnect there for me. I don't really understand, like, okay, if this is marketed as attainable, if this is marketed as something that, you know, a girl can just go to the gym and prep for 12 weeks, well, then why are these compounds being used? And, you know, why is there such a bad rap around men using them if there's no risk? So that inconsistency in information and lack of information really, that drove me to want to learn more about what I potentially was going to use. And I mean, even within that, I was returning to stage in 2020, and I knew, okay, well, I've never competed at the national level. I've only gotten the impression from other athletes that it's very competitive. And the current standard in 2020, I guess the standard in 2020 was much greater than it was in 2015. It was much greater than it was in 2016 and 2018, and it continued to evolve. So I wanted to go in with realistic expectations that, like, hey, if I get to the point where I decide that enhancements might be worth the risk, I want to understand what I'm doing. I don't want to be someone that is kind of going through the motions and just blindly accepting, like, yep, this is what we do, and this is what every female does, because I mean, it's just not true. And there's so many discrepancies amongst PED use that it's like, okay, there's got to be an optimal way, just like with diet, just like with training. There's got to be a way that sucks and that is like not recommended, like worst. There's got to be an equivalent of the 900 calorie starvation diet and the 2.5 hours of cardio, like, and what is that? And then what's the opposite? So really, when I started diving into this, I mean, I would say over the years, I've always had that interest, but whenever I started to really consider, hey, this might be a threshold I'd like to cross, that's when I started to really force myself to be like, okay, the responsible thing, if you were going to use anything at all, it's to understand what you're doing. And you don't have to have the path of this down, but you do need to have a reason. You need to have rationale. And if side effects do occur, you need to be able to say, well, you know what, I knew this was a possibility. I never wanted to feel blindsided, which we see all the time with female athletes. They think they're taking a precursor to X, Y, and Z. And it's like, nope, that is not even the compound you think you're taking. So it's like, yeah,
it's scary. I think from a sort of education standpoint, I do still feel like the UK are slightly behind from an amateur level. Like, you're talking about really comprehensive thought processes there, Cory, that I know hand on heart that I was just not acutely aware enough to be doing at that point in time. And I was very new to the sport. I was quite easily led. I wasn't making decisions. I mean, I wasn't sort of contemplating PD usage at that point, but nevertheless, even with the dieting and the training, I was very led. Did you find that was one of your biggest motivations? Was it the observation that people were being led in a fashion that wasn't in their best interest? Is that what motivated you the most to actually share not only what you've applied to yourself, but to obviously to the wider audience, to make sure that information's out there?
Yes, I mean, it's like you pulled it from my head. That's exactly it. Like, it's the 20-year-old that is doing her first national show, and her coach puts her on an anabolic, and within a year she doesn't sound like a woman anymore. And like, I try to be so careful talking about the voice change, because truly, like, I think I've said this on every podcast, because I really want to hammer it home. Like, I know I have a lower voice. I don't have a very like uppity, flowery voice. And there are a lot of girls who don't have that either. Like, naturally, they just speak at a lower octave. And when you're looking at someone who naturally has very bad breakouts with like acne, for instance, or you look at someone who naturally has more body hair than they want, and you start to realize, okay, well, like it is very individualized how these things can be exacerbated, but it's hard to know, like if you're someone who's struggling with any of those, I don't want to say problems, but just those things. If you're dabbling in PEDs and you're not aware that, hey, these are not only very, very realistic outcomes if you're doing this incorrectly, they're almost guaranteed if you are abusing it. And there are a lot of coaches who don't bat an eye. I mean, like immediately the starting dose for that 20-year-old is a dose that you would look at and be like, where is the rationale? Because I don't see any. It seems like this was like your only option from your source, and you just said, okay, well, they only have 30 milligrams, so you're going to do that, you're going to sixth it or whatever. And now it's like, well, okay, no wonder her voice doesn't sound the same. Oh, she ran that for 6 months. Oh, she ran that back-to-back seasons. And it's like, that shouldn't have ever happened. Like there was no consideration. And this isn't one of those things like I want to bash coaches on, because I do believe I'm very, very big into personal accountability. But with the lack of information, it's hard to hold that same standard for women as it is men, because even men, they still don't have the best information, but they have something, and you at least have some some degree of guidance there. But with women, we're severely lacking that. And I think being able to go to sleep at night and know, like, hey, I don't have the answers, and I don't have the answers for everything. This is something that truly, if you want to fully understand, you should pursue that yourself. But if this can establish at least a foundation, if it can answer some of those questions, and honestly, I've been very consistent with these videos for now several months, and what I'm finding is that the amount of girls who are reaching out and they're booking consult calls, they're asking me to look at their book, and they're like, my coach like literally is what you're describing here. And I was about to do exactly what they said. I just thought, hey, the national shows are coming up. Let's go. And I mean, I think on some level I know on some level that needs to happen, but to know that, hey, at this point in my career, this is something that I can provide. That feels very good internally.
Absolutely. I think coming to that kind of like over prescribing of PEDs or kind of pushing it, beyond physiological levels, like I suppose just to give the listeners a little bit of context, what do you tend to see in those cases when it comes to PED cycles, both in prep and off season? Because maybe people might not understand, if they're listening and they're kind of going through that very thing. Like you said, those people that are booking the consult calls, you might have a load of them after this podcast. But just, I suppose, to give people a bit of understanding, like what are the things that they might want to look out for when it comes to, like I said, the overprescription of what they're getting from their coaches.
I think the use of anabolics, I think that's a very important one to consider. And I think it's something that, honestly, when we look at how often anabolics are used to cover up a Band-Aid, and some used as a Band-Aid to cover up for planning, for coaching, I think the anabolics, that's probably the one that really needs to be addressed. But then you get into AIs, which I can't tell you how many bikini competitors at the national level, they just kind of accept that as like, hey, this is gospel, this is what we do, like 20 micrograms. Yeah, I forget if AIs are actually micrograms or milligrams, so apologize, but I honestly, it's kind of a testament to how long it's been since I've looked into them and to the dosing. But I do want to say, like, with any of these non-androgenic PEDs, there is certainly a way to abuse them, and there's a way to use them to restore, whether that be a process that is diminished or downregulated into prep. But I feel like when we look at what compounds are posing the most risk to female athletes, I would say it's anabolics, because I mean, when you start looking at comparatively, at AIs, for example, you're looking at a process that it will cause hormonal downregulation, but we do see that women can be very resilient. I think it's hard to argue that something that can be reversed is as dangerous as perhaps a change, anatomically, or a change in voice that honestly it might not be reversed. So when I start to get into like the things that people should look out for, it's, hey, okay, well, did you just sign up with a coach, 4 weeks ago, and you said you want to do a summer show, and now we're looking to find you some Anavar? I mean, that should be something there might be a good reason, but what is the reason? And if you don't know the reason, and if there's not good rationale there, I would encourage you to explore it. I would encourage you to have that dialogue. And if the coach is unwilling to do that, I would say that's probably another consideration you need to make. Okay, why are they unable to have this conversation? And is that something you're okay with? Are some people do really, they want to follow blindly. I have clients currently who are like, they don't have that interest, and that's okay. But if you're following blindly, I do think it's important to know the risk, to know, hey, this is very possible. And every time that we put this in place, like, you are putting yourself at risk. So contrast that with, hey, are we doing everything else we can? Is my coach actually looking at my training? Do I actually have a training program from this coach, or am I just kind of doing what I've done since high school? I think the use of the wrong compounds is something to certainly look out for, and that comes from knowing what those compounds are. I think also understanding proper dosing. And I think with anabolics, you really have to consider, okay, if we're using this, what is the rationale for starting above the lowest dose possible that's effective? If someone does require a higher anabolic load, okay, that's understandable. But if you're working with an athlete for the first time, and you're put on 10 milligrams of Anavar, it's like, what? Like, what? Oh, because the clinic only makes 10 milligrams of Anavar. Got it. Well, yeah, that's why.
I think it's very common. I've heard a lot of stories in the UK. It's Anavar in the off season it's just a very, very common thing, and it's not just for 4 to 6 weeks at a very low dose. It's a very high dose for a very long period of time, and then there might be a break, and then they're back on it in a prep for probably the entire prep, alongside all other things. So you do hear a lot of I suppose stories, especially when it comes to the off season, and I think that's where there can be a lot of trouble, because I think people are very willing to take the risks potentially on a prep, to preserve the tissue, but in an off season, ultimately, like, you have everything there to be making the progress that you need to make. And I think that's where the I suppose the highest risk, in my opinion, can be, because it's just for such a long period of time as a whole. Is that what you tend to see kind of with people, I suppose the length of time that they're on the higher androgens in their off season? Or are you kind of, against even the, I suppose, going higher risk even towards the latter end of a prep when it comes to those more cosmetic drugs as well?
I think I would rather see someone use an anabolic in the off season, but for a very set period of time, and not necessarily off the rip. So sometimes that if we were looking at a calendar, we could, like, your annual calendar, that I would just like say, don't put it in here. If we're talking relative to the off season, well, hey, we're immediately post show. What do we know hormonally is happening? Well, we know estradiol, progesterone, they are downregulated. Thyroid is downregulated. If you're not using any kind of restorative support for testosterone, likely downregulated. So it's like you're in this state where, from a health standpoint, like objectively, you are not in a position to grow. Yet we do see coaches get very comfortable in pushing that, hey, well, your post show, and I gotta say, like, the motivation really, it seems like it comes from this athlete is still lean, therefore they're still marketable, and I can squeeze a little bit more out of them. Now, I'm not saying that is always the case, but I do think that we have to be realistic about bikini being the lowest barrier to entry. It is the division that will drive the highest return for coaches. So understanding that, like, hey, you know what, like, you can have a girl who has some muscularity and you work with her for a year and you can make her look extremely competitive with a little bit of something here and there if we're just looking at the aesthetics. But when you look at what is the right use of these compounds, I mean, I think immediately post show it's just not appropriate. That person isn't recovered. And then, you know, even relative to that individual's timeline, if you have an athlete who is likely going to be off stage for a significant period of time, why would we rush that first cycle? Why would we put that in place, you know, let's just say 6 to 8 weeks post show? If they're going to be off stage for 2 years because they have that much muscle they need to build, one, that's still so close to when they just competed. You know, are they actually restored? Are we looking at lab work to confirm that we're making progress and we're trending in the right direction? Or are we just kind of, hey, you know what, like, this athlete is getting bored, they don't like how they look, this is a little edge that will make them feel like I'm worth staying with as a coach. And I mean, the psychosocial of understanding the coach-client relationship, like, that's very, very real. Like, I mean, it's something that it's easy to say, no, this coach wants the best for me and we have a real relationship and all they care about is keeping me healthy and seeing me out. It's just not a movie. And like, that's just not what is happening in reality. Like, I mean, coaches are trying to make a living off of their athletes. It's a business, but keeping that in mind when someone does suggest something and really considering, okay, well, is this actually in my best interest, or have I been verbalizing things to my coach that potentially are making them think this is the only route, this is the only way that I will continue to work with them, because in the off season it is so long and so slow for us to make progress that, I mean, like, I'm very proud the majority of my clients, they come to me and they're like, we're doing a 2-year off season, like, I have 10 pounds of muscle I need to build, I don't want to rush it, I don't even know if I ever want to take PEDs, but I want to be set up so that, like, I can if I need to, but I want to make sure all these things, like you say, like, okay, all the boxes, I want to know what these boxes are and I want to know I'm checking them. And it's like that's really nice off the rip to hear, and that excitement, I mean, that's appreciated, but it's also like you're actually in it 4 to 6 months into that growing phase and you're like, my weight's gone up, like my weight's gone up, I don't look as aesthetic, I'm not seeing the progress maybe I thought I was seeing. It's like, well, how do you explain to that athlete, like, hey, like, you need to grow and we need to sit here and we need to see training performance go up, but putting in an anabolic, it might not be the best move currently. That might be better placed towards the end of off season, maybe as we're hitting a plateau, and you know, who knows, maybe earlier, but it is all relative to that athlete and their needs.
Yeah. And I think you mentioned it there, Cory, like, I think in bikini, because of the entry level of bikini, it does attract more first timers, more people that want the initial exposure to the sport. And you find the majority of that exposure comes from observing people in prep, observing people who are shredded, they're sparkly, they're on stage, they look fantastic. And I think that relative sort of picture, so what they want to achieve versus the myself and Grace talk about it so heavily on the podcast, the longevity and importance of having that baseline ticked off, and that baseline sort of covered your eating, your recovery, your training. Are you being optimal in all of those places? Because putting an androgen or a PED in its place is only going to, as you say, mask the lack of sort of foundational support that you have as an athlete. Do you find that the culture is moving more towards that with your clients, or any exposure you have to the sort of bikini space at the moment? Or do you, I mean, certainly from the UK standpoint, I still very much feel like the culture is, I want to get on stage yesterday. Do you still find that? And how would you sort of approach that with your clients?
I think I am able to connect with them in a way where I share that, hey, you know what, I've gone into preps that I knew I didn't have the muscularity I needed. And although there was a lot of learning and there's a lot that came from that experience, it still ended the same way. It still ended with me getting off stage and like, regardless of placing, it's like, oh man, like I probably would feel better in this moment right now if I had taken another 6 months off, if I had really focused and like not been so impatient. And, you know, granted, there are clients that we have that discussion and we go into it and we're like, okay, realistically, this is what you need. But where you are in your life and your commitments that are coming up in the next several years, you might not have the ability to be as flexible as you are right now. And maybe right now your life is more conducive to having a better prep. So as long as it's understood, hey, this isn't where you need to be at the beginning prep. But if you know that and you're okay with still going through it, I can do it. Like, I will be your biggest cheerleader, but I'm also not going to lead you into a prep and tell you like, hey, like you're as muscled as you need to be, because just frankly, like that's just very unlikely. Most athletes think they have more muscle than they actually do, myself included. So it's like, honestly, what, like, we can go through it, but I need to know what is the reason you want to prep January 1st? What is the reason you want to be on stage at the Clash? Is it something that is nostalgic and like, hey, you want to compete regularly, and that matters so much more to you because that is an identity that you have, that is something you want to uphold. If that's the case, again, we can do that. I really don't want an athlete to get off stage feeling the way I have, where I'm like, man, I didn't know that I was going to be that outsized, or I didn't know I was going to be miss the mark with conditioning one way or the other. And I think that's where it's helpful, but it is a hard conversation to have, because I mean, you guys both know this is such a vulnerable thing that we do. We put our entire lives into something that it's 24/7, and if you don't want it, it becomes so apparent very quickly when the diet gets hard. So it's like, when you see that with the athlete and you know that like, hey, they're gonna reach that point, and they might have those same doubts, at that 4, 5, 6 week out mark, where they're like, I still got to lose fat because like I'm leaner than I've ever been, but it's like, hey, your tie-ins aren't there. You don't have enough muscle. So unfortunately we have to keep going. And it can be a struggle, but I mean, it kind of goes back to, what I said earlier with, hey, like I know at the end of the day, I have a responsibility to coach someone, but I think even more than that, I have a responsibility to be honest about, hey, with my expertise, here's what I can tell you will happen currently. And if you don't agree with that, cool. But this is what I would do. You're an adult. You can make this decision, or I can help you make this decision. So I think that, I don't know, did I answer that okay?
Absolutely. No, absolutely. I think it's very common, fortunately, for, like you said, male coaches to push their athletes into a prep, because it's so easy to put a bikini athlete on stage and get more business from it. But I think that's why we want to get you on as like a female coach who's been through it and is a bikini pro and knows the standard and the growing standard. You just have to be utterly and entirely honest with the clients that come on board and say, look, this is what you need, and if you want to keep your health intact, and like you said, enjoy the process, it's absolutely key to take that time off and come back when you're ready and actually competitive. I think we lose that word a little bit when it comes to competition. You actually forget you need to be competitive. It's not just a dieting contest. But I think just touching on the more enhancement side of things, I want to delve a little bit deeper. You obviously, we touched on kind of the androgens and anabolics and stuff like that, but I think a lot of people fail to learn more about, because again, it's just pushed on by coaches, but it's a non-androgenic side of things, so things that don't cause obviously side effects, like in terms of like viralization, etc. What would I presume when an athlete comes on board and that's the kind of route that they want to take, I presume that is kind of your would it be your kind of first port of call from a cycle standpoint? Not really a cycle, but how would that process work if a client was to come to you?
I feel like I'm not going to give the answer that people want to hear, but I do have a vetting process even once I start working with a client before introducing non-androgens. And that simply comes from knowing that, like, hey, even if it doesn't pose the risk of virilization, I'm still asking someone to do something that is illegal. Like, I'm still asking them to obtain something and take it, and it's not under the guise of a medical professional. I mean, like, it's a little sobering to hear that, but that is what it is. And I do tell people, there is only so much I can gain even on my consult calls. Like, before signing with any athletes, I actually have a face-to-face virtual conversation with them like this, where we get to know each other a little bit, because I want to know, like, hey, what kind of person am I bringing on? Am I okay with the commitment? Do I think like this could not necessarily be the best fit one direction or the other? And do I feel like this person is just ready to drive forward with the PEDs? Even if we're talking about non-androgens, it's still like, okay, is that where their idea is around like bodybuilding? And unfortunately, it is the case. Like, there is a good amount of individuals who hire me, and I find very shortly on, I'm like, okay, they don't want to be adherent. They just want someone to prescribe drugs. They just want someone to say, it's okay to take this. Here's a source. This is what you're doing. I'll monitor you. But when it comes to like the diet, the training, they're like, yeah, I'm kind of wishy-washy. And honestly, I think that is something that, like, I mean, it can get sticky, because you can be like, well, this person is paying you to get them the best results. Dieting and training are very effective. Like, the supplements are really supposed to be something that we add on. And I mean, like, we're talking bikini. Like, I can hear how listeners might be like, oh, well, this is bodybuilding. It's extreme. It's extreme. Yeah. But we're in bikini. Like, we're not talking figure. We're really not even talking wellness. And even for wellness athletes, I would still say, like, okay, ethically, how invested are you into doing this the correct way? Because there are coaches who will have a lower barrier to entry and just be like, yeah, here, week 1, I haven't even seen pictures of you. Here's your plan. Here's your thyroid hormone. By all means, like, here, we're just going to get started. And I do like to see from that athlete, at least for a few weeks, like, hey, what is their behavior like? Do their actions match, what was discussed on this call? Am I missing anything around, like, hey, maybe even a non-androgen, non-anabolic, maybe that isn't appropriate. And even outside of, like, the behavior, if someone does find that, like, hey, they've reported signs of hypothyroidism, but when you really start working with them, you're like, I don't see this reflected in lab work, and I don't see this reflected in symptomology. Maybe there's another issue. Maybe these reports by the client early on are not exactly hypothyroidism. So I think for me, it's not the way every coach is going to do it. It's not to say every coach should do it this way. It's just the way I've found, I feel is still safe and still, ethical. But when we start looking at those non-androgens, I mean, I would say in the context of contest prep, you do have several tools that you can leverage. And the good thing is we do have evidence to support the use of these drugs. And I mean, clenbuterol is one that I know a lot of people, they will say, okay, this is going to result in, potential cardiovascular outcomes down the road. There are 2 studies that, I mean, John is very upfront about, like, hey, we have a study where people were on T4 and T3 for 17 years, they did find that there wasn't any kind of downregulation after ceasing using thyroid hormone. Now, 17 years, I wouldn't say that I would ever keep a competitor on it for that long. I think that's excessive. Even when we're looking in the context of a coaching contract and you're saying, okay, well, should this person be on any of these supplements for an extended use? No, there should be a game plan. There should be an intention behind using them. So when we look at other non-androgens, we look at clenbuterol. I think PrEP is the appropriate setting for clen to be deployed. However, when we start getting into athletes' needs, I mean, we do have a lot of individuals who are in those shorter height classes who naturally, like the heaviest they get, they will be 110, and their stage weight is low 90s. And for those individuals, maybe they don't have the ability to tolerate a lot of food, or get away with such little activity in their off season. So if that makes sense to have them in a position during a mini cut in the off season where they do have that additional support to their metabolic rate, I can see a rationale there. But I hope listeners are able to hear that, like, hey, it's not just we use clen here, we use thyroid hormone here. It's like, what is there a case use? Is there an actual need for this? Because alternatively, it's like some people, they're on fire, and like they don't have these plateaus that sometimes are commonly reported. They might not need that same support initially in a contest prep. They might not need support in the off season. And that's where I think it's really important to be accurate with like the dialogue around the use of these non-androgens, because it's like, I don't want someone who has a very resilient metabolism to think, well, Cory said thyroid hormone goes in week 1 of prep, or thyroid hormone goes in week 8, or I need to use clen during my off season on my mini cut. It's like, no, like it's got to be individualized. And I think that's where having a coach who does understand that can be really, really impactful.
Absolutely. I think as well with the thyroid hormone, it's like you really have to look at blood work before you decide anything, because somebody could naturally have, hyperthyroidism, and it's like you're throwing something in when they're already on that higher end. It's like that is going to cause problems, and they could go through their entire prep never needing that kind of supplement. It could never need clen either. And I think when you're looking also at the price of the likes of growth hormone, like you have to look at that individual. Are they in a position to actually do that? So there's numerous things that you look at, and I completely get where there's all of this information online and people are thinking, oh, I must do this at Y time and all that kind of thing. But it really is down to your coach to decide, and making sure that you have a coach like yourself who kind of knows how to, I suppose, prescribe it as well.
Yeah. I think from that standpoint as well, Cory, you've again noted it's the underlying thing, it's the habitual like sort of tendencies of a client as well, because they could come to you and say, I've got hypothyroidism, and maybe they're not adhering to the baseline sort of step count or expenditure that's away from sort of training and things like that. So I hadn't even considered that might even be a consideration at some point, because I think from my standpoint, I've been quite fortunate in being surrounded by people that have really hammered home the importance of those foundational things. But to have somebody to come and sort of blanket prescribe, even if you're looking at blood work, you might not take into consideration the things that they're doing outside of their training and the diet and things like that. There could be so many manipulations you could make before just prescribing that, because it seems or it appears that the blood work are indicating that it might be a problem. Is that something that you've learned to do, like, or is that something that sort of observing your own tendencies and coaching yourself, is that where that's come from?
Yes, yeah, I think having something that's a little more objective, that we do know is indicative of our hypothesis, hypothyroidism, and understanding, okay, well, we can definitively say, yes, in prep, your thyroid function will be downregulated, your hormonal function will be downregulated. This is in the context of someone truly getting staged lame. However, when we start making rationales around use. It's like, it's nice to have that lab work and to have these studies and to have evidence that, at least for the clients that, you know, they might be eager, they might say like, hey, I know this is what needs to happen. I am nervous. You can emotionally, you know, coach someone and tell them, you know, anecdotes. You can tell them your experience. I think having something that's very concrete, that's irrefutable, I think that can be really powerful, you know. And I think lab work, I mean, in some cases, like, people might not understand that, hey, just because the reference range for testosterone says 0 to 22, and for listeners who are not in the States, I apologize, it's nanograms per deciliter. But if that's what it says on the panel, they might be like, Coach, I'm fine. I'm at 10. I'm 50% of the way there. And it's like, oh no, like, this isn't where we want you. We can find areas for improvement, you know?
Absolutely. And in terms of like reversing off of these non-androgens, like your thyroid, like, how do you like to approach it with your athletes? Because I know myself, I spoke about it in literally the last podcast, but went through a really, really difficult time in 2021 with my thyroid. And I suppose I always like to hear how other coaches like to approach it, and their approach to, you know, thyroid therapies in the off season. Is that something you are for, or is it a case that it's quite like individual dependent again, and I suppose where that athlete wants to sit and their kind of future competing goals? Where's I suppose, where does your coaching come into that?
I think it makes a lot of sense to continue thyroid support, at least initially post-show. I'd say minimally that first week. Granted, there are individuals who, I mean, they might pull it out, and, you know, from an outward perspective, you're like, oh, there were no negative repercussions. So I want listeners to understand that, like, hey, you know, this might be plan A, but there are outliers. So you might find someone who doesn't necessarily need it. But the reason I would keep it in is because, I mean, you were in that downregulated state. You're going to find that there's less circulating T3. And I guess if in the case that you are already supporting thyroid, it's exogenous, so those levels are suppressed. So immediately when you pull it out, you need to know that, like, hey, you're pulling something out that's helping facilitate the current state you're in. So there's going to be a little bit of a buffer in terms of restoration. Now, in the off season, and I should preface this with, like, I don't predominantly work with athletes that are above wellness. I do work with them. I do have some figure girls. I've had some physique girls, but my primary demographic is bikini and wellness. And even within that, largely bikini. So when I say, like, you know, I'm personally not a fan of incorporating thyroid in the off season, it's not to say John might have individuals who, majority of his demographic, maybe his female athletes, with their goals, their aspirations, and the state that they're in, you know, relative to when they want to compete again, maybe there's a good argument for it. What I find with majority of my clients is that the off season is incredibly hard, and there's more coaching that needs to go in around coping mentally with not being stage lean. And I don't, in that case, thyroid hormone should be utilized to mitigate some of that, I would want to say, that gap in how they feel they should look while they're in that building phase. However, I would say even within that, if you have someone who's downregulated, it's important to understand, well, is this person dealing with a true dysfunction? And are there issues still within my scope of practice? Because in theory, if someone is having, you know, true hormonal dysregulation that is not prep induced, it's something that is a little bit deeper. I have no problem saying you should seek medical support for this, because I'm a coach. I am in nursing school. Even if I had the RN by my name, even if I had doctor by my name, I'm not your doctor. Like, I'm educated, but also respectful of, like, here's my scope of practice. It kind of ends here. So it's something that over the last couple months, I've had to be really good about setting boundaries with clients around, hey, you've got Hashimoto's. I can work with you, but you should have a professional in your corner, because you're not hiring an endocrinologist month to month. Like, it's not a concierge like kind of service. And I think that's where it's important also for athletes to understand, like, hey, what is reasonable to expect of coaches within the scope of hormonal management. So I'm not personally, I don't think I've had anyone in their off season that I've been like, oh, this makes sense. There is a good rationale for this. And we've gone through that off season with them, and they found that, yeah, like their body fat did climb. They got to that productive state. Maybe we did implement a mini cut. Maybe we looked at their programming and saw, okay, you know what, you're not consistently executing in terms of your activity, or your adherence is not as tight as it should be. But my initial instinct isn't to reach for a non-over-the-counter supplement, or even an over-the-counter supplement for that matter. It's, hey, what is fixable, what's easy, and what is something that ultimately, if you correct this is going to help you later on. And if it's a problem, it's like, it should be corrected, right?
Yeah, absolutely. I think there is a misconception, isn't there? And I've fallen foul of it, of thinking that continuing certain therapies and things like that are going to keep you in an optimized state, or they're going to make you feel better, as you say, especially in the off season. I think specifically in bikini, there's so much sort of attention that is drawn by you being stage lean and prepared for a show, as opposed to being in off season. We've noted it before, that attention and that sort of fuss, if you like, drops off. From a misconception standpoint, Cory, like I know we've covered briefly sort of thyroid therapies there, but from like a hormone, human growth hormone standpoint, are the misconceptions that you come into contact specifically with growth hormone, but other sort of androgens and other sort of compounds that may or may not be used within a sort of an off-season or a prep setting, are there common misconceptions that you are repeating yourself over and over again to clear up?
I think specific to growth hormone, I think that's something that, there are a lot of misconceptions around what it should be used for female athletes. I do see a use for it, but I think, what needs to be understood is that it's very difficult to source growth hormone. It's very expensive. A lot of the athletes that I see, hey, they want to know, they're like, hey, I have things in place already. I'm at that point where I can add in maybe a different non-androgenic compound. When we consider growth hormone, I mean, the financial side is absolutely something that I stress up front. I'm like, hey, if this person is not equipped to handle that commitment, or even if they say they are, I just make it very clear, like, hey, this is going to help, but this shouldn't be something that you look at like it's not magic, and it will help you, but you have a lot of things in place that are much less costly that will help. I think growth hormone does have a really good rationale for females, because it can add a lot of benefits in terms of contest prep. I think in the off season, I mean, again, like now we're talking about, another extension of supplementing with something that is very expensive and very difficult to acquire. It's like, would it make sense? In theory, yes, absolutely. If I could have all my clients, great. All my clients relative to who is appropriate to take it, who doesn't have any, who don't have any kind of past medical history of cancers or other disorders. But I think, when it comes to the misconceptions around HRT, the idea, I mentioned this earlier with the AIs, is that you have this belief that is circulating that, hey, like we need to suppress estradiol in this case, because that in itself is what's preventing you from truly achieving that stage condition. It is preventing you from having those crispy tie-ins. And we know that's just not true. It's a cop-out. And when you look at how AIs are used in the context of IVF, I mean, they're helpful in some ways for women who are estrogen dominant, and that is a problem for them in their own aspirations. But estrogen is very beneficial and is actually helping us throughout that process of prep. So having that ovulatory cycle, yeah, I know, like I the week before mine, I have that really crazy fluctuation in emotions and body image. It sucks. It sucks, but I promise, like having that cycle, assuming you're actually ovulating, it is helping you more than it's hurting you. And I think getting that message across to individuals that, like, hey, you don't want to see your lab work come back and estradiol suppressed. That's not one of those things that you're like, oh, that means I'm going to be less watery. You don't want to see that. Like, that is a problem. And in that regard, seeing progesterone suppressed, that can be problematic as well. So I think truly understanding what these hormones do and understanding that, like, hey, you're going to be in a setting where everything that you're doing is conducive with these hormones becoming downregulated. It's very unlikely you are going to sustain optimal levels, even if you start out that way. So for individuals who are not starting out that way, or individuals who are having chronic issues with sustaining normal high levels, relative to testosterone, it's like you really want to have that conversation with the client around, like, hey, here's why we might want something that is more stable if you're going to be competing and potentially unable to take off the appropriate amount of time in between shows. I know that in itself is a conversation we can go pretty deep into, just around the HRT side of things. But again, it still kind of comes back to, okay, well, what is the purpose of having this in? And potentially, is this just a Band-Aid?
I think dosing is also so important when you're looking at, obviously, the likes of growth hormone in healthy individuals, but especially in HRT as well. And I do know over in the States, it is prescribed, as far as I'm aware, quite highly. I'm not sure if you're aware of that comparatively to the UK. The HRT, yeah.
It's birth control is prescribed widely in a medical setting, and I guess that's a good distinction. Is like, you have HRT clinics, you have wellness clinics that will prescribe. Some will prescribe testosterone. I have not had an experience with an HRT clinic, or even like anecdotally through a client's experience, where they haven't overprescribed. And that is something I'm like super, super passionate about, women understanding that, like, hey, you have these clinics that are like, oh, don't go to your doctor. Like, I got you, I'll take care of you. But they're putting women, in a lot of cases, like very frequently, they're putting them on 15, 20, 30 milligrams. And there are cases where women are like coming to me and they're like, yeah, I've been at 20 milligrams 2 times a week. Like, that's what my doctor told me. She's a woman. So, I felt really comfortable. And we look at her lab work, we're like, your testosterone is above 400. Like,
yeah. And they think it's replacement therapy, but they're also then maybe on contest prep or off season, and they're getting thrown Anavar, and it's like, it's just a recipe for disaster. And I have heard of a few cases over in the US. But I suppose, just touching on that, Cory, like, when it comes to that kind of overprescription of HRT, and then obviously the addition of androgens in a contest prep, but in the form of Anavar and stuff, what do you tend to see when this person maybe comes off those very things, or reduces their androgen levels entirely and comes off these things? Do you commonly see this and side effects off the back of that?
I guess a follow-up question, are you, I guess, specifically like to Anavar, or to are you referring more towards HRT, like
I suppose,
testosterone?
well, I suppose maybe more towards the kind of Anavar situation, but even if people were to come off it entirely as well.
Yeah, I think for Anavar specifically, I don't see a lot of side effects happening post cycle. Like I don't see someone necessarily having serious adverse reactions, but I do see there is a reduction, obviously, in how full they look, and you know, listeners they might think, okay, well, I thought that was permanent muscle that I gained, and if you gained muscle well, if you built muscle while taking Anavar, like hopefully you retain it, but the states you're in, anabolic versus catabolic, it's very fluid, you know, so however long you're spending in that catabolic state, that's kind of going to determine, and everything you're doing while in that catabolic state, that's going to determine whether or not you're retaining that muscle. But immediately you will, not immediately, I say that, I know people will hear that like overnight, you will very soon see that like Anavar, also because it has a short half-life, but soon you won't look as full. So I mean, like I would say that's one of the bigger things that people they tend to get worried about, because then they're like, they have this positive association with being on Anavar, and they're like, I looked amazing. And especially smaller athletes who are you know, striving for that higher degree of muscularity, they're like, I only look amazing when I take Anavar. And it's like, okay, do we have creatine in place? Like, have we built muscle? Like, are you eating enough? Are you like, it's such a silly comparison, but it's like, I know it's not going to do the same thing. But obviously it's just like, it can become dangerous, I think, for people to get attached to how they look when they have that compound in place. And I really would recommend like kind of stepping away, like when you are post cycle, like remembering like, hey, using this, and yes, it's a beauty drug, like we're using it for aesthetic physique goals, but it's intended to work in a capacity in which you allow it to. So I mean, like you're taking Anavar and you're finding that, you know what, I'm in off season, I'm going to party a little bit more, I'm not really concerned if I'm like only hitting 50% of my protein. Well, I'm going to the gym, but I'm not, the squat rack's taken, so like you're consistently like missing all of your big movements. It's like you can be on Anavar and like it's gonna make you look a little fuller, but like it's not really conducive with like the outcome or the reason it's in place. Yeah, I
think it's remembering that risk, isn't it? It's the risk relative to the actual goal. So if you have it in place for a purpose, like you say, and it's there and it's optimal and its use is justified in air quotes, because I want to say obviously that justification will be individual to a client and the purpose for which they're taking it, but actually having it in place when it's not suboptimal and there's no particular reason other than just to make you feel good, I think the risk has to be remembered at that point. Touching on the sort of the AI and the androgen sort of impacts on females and their physiology, in particular the reproductive system, are there common side effects that you see as a byproduct of it? It could just be a case of supplementing to a super physiological level, like your testosterone levels, for example, or the implications of androgens. Like what have you seen in your experience, and how that impacts particularly bikini athletes and their reproduction?
I personally have found that, you know, the use of an AI, I'm very open that I have used AIs. It's not something moving forward I feel is necessary for myself or for athletes. I mean, I know there's going to be people who are like, hey, but what about, and I get it. I just think globally, for me, it's not something like I don't have a good use of them for myself or for athletes. But what I found in my experience is that AIs, I mean, like they do have a negative impact on neurological function, and we do have studies that support this. That in the use of managing breast cancer patients, there's a significant decline in cognitive function. And it's one of those things you're like, well, how do we have evidence of this, and why is that well known but still being prescribed relative to bodybuilding?
I think I don't like kind of bashing the male coaches, but sometimes I do think it's like an ignorance part, and they're not females and they don't really, unfortunately, not that they don't care, they don't have any awareness, or they don't want to learn more about female physiology, and they just know that this thing does this thing, go ahead, you know. And I think as male coaches, it's on them. They have the responsibility to learn more and know exactly what they're giving their female athletes and the repercussions off the back of that as well.
Right. And even within that, it's like you look at outside of, you know, potential neurological impacts, but you look at how this is going to affect an athlete long-term from an ovulation standpoint. I mean, for years, I had an issue with my progesterone. Like, I mean, we're talking 4 or 5 years, and I was supplementing with HRT for progesterone, and I still was finding, I mean, yes, progesterone is very hard to test correctly just because it has such a short half-life. But even the dose I was at, I was still finding repeatedly it wasn't moving me up for so long. And even though I was having a period and my estradiol was technically within range, it still is problematic to have low progesterone in accordance with estradiol is now unopposed, which does put you at risk for I believe it's uterine or cervical cancer, but puts you at risk for cancer. And that's something that I think listeners, I mean, like, I don't want to say, oh, hey, well, if your progesterone is low, this is something you need to quit bodybuilding. But I do think you need to explore it more and kind of find the underlying reason why, because I didn't really see restoration until this off season. And I mean, like, we're talking month 9, month 10. Like, I mean, it wasn't until the point where, like, I had been out of prep for so long and sitting at a higher body fat relative to necessarily where I would want to be, or I would say is necessary, but sitting in a state that's truly like non-deficit. That was when I started to see some restoration. And it could be from, and I can't pinpoint it, but I do know that leading up to having issues with progesterone, I was using an AI. And I mean, that again, like, take it for a grain of salt, but I do find that a lot of women who have that lower progesterone, or even, I would say, lower progesterone, lower sex hormones in general, it could be exacerbated if they were already on the low end by the use of some of these drugs. But I mean, yeah, I think prep will do it for you. It will definitely cause you to really consider, okay, well, hey, if I'm going to be doing this often, if I'm going to be competing frequently, am I comfortable sitting in this state knowing that, like, from a lab marker standpoint, I'm not optimal, like, things are not functioning the way they should, and down the road it's unclear how these things might impact me relative to fertility. And that's something I think you have to be very careful with. If you're someone who has underlying issues related to fertility, I would be very mindful of, like, hey, how long are we spending in these states where hormones are downregulated?
Yeah, absolutely. I think exploration is the key there. Like you said, the key word there. And on that note, like, is there anything just for the listeners, like, kind of questions that they should be asking their coach around this kind of topic? And I suppose, how do you think coaches can improve their knowledge going forward?
I think, you know, J3U is an incredible resource. I would recommend, if you don't have a background in, if you don't have a familiarity, or honestly, even if you do, but it's not specific to the physique athlete, I would still consider outsourcing and figuring out, okay, where are the gaps in my knowledge? And I guess I'm speaking from a coach's perspective, but also from an athlete's perspective. I think the best way to equip yourself with working with coaches who maybe it's unclear their knowledge bank, and it's not necessarily you need to learn everything they know, but you should have an idea around, okay, well, what areas can I not answer? If I have questions about this as an athlete, if I don't know the answer, where can I find that answer? And maybe that is looking to an educator within the space. Maybe that is going through J3U, whether that be the initial model, but I think the female model, I think that is better suited just because it is highly specific. But even within J3U, I mean, John does an excellent job answering the forums like daily. So I mean, like as a coach, I would say if you are finding that like you're in that learning process and you're like, I know these things, but I'm still having questions. I know I'm not optimized in how I'm delivering this information for my clients, or I don't have that certainty. I would highly recommend reaching out, and I guess not reaching out, joining J3U, and then really taking advantage of that aspect of the service. But in terms of questions for clients, I mean, I would want to know personally, like, I mean, just very, very simply, I would want to know, hey, what are the potential risks, with X, Y, and Z? And even if that's not a deal breaker, well, at least you have it in writing. At least somewhere down the road, you can be like, okay, well, I feel a little nervous about taking Clen. That's right. My coach told me that like all of these things, these are potential side effects, and they are acceptable within reason, but I should keep that in the back of my mind. So, I mean, understanding the side effects, understanding the use, understanding, hey, like in the prep itself, how much are we going to push this? How aggressive are we going to be? Are we going to titrate up to 80 micrograms? Is that something you do with other clients, or is that really individualized to the point like it almost never happens, but maybe it is on the table? And I think having that dialogue, just expressing to your coach like the reason you want to know these things, I think as a coach that can be helpful as well. I find it helpful when athletes are explaining that like, hey, I'm a little nervous about what we're doing. I'm on board. I don't want to not do it, but I think I feel better if I understood X, Y, and Z. That would be my advice.
And I think it's reassuring, isn't it, just to know that your coach has given those considerations. Like not only as an athlete and your responsibility to protect your own body and to have a foresight for how that might affect your own body, but also having that reassurance that your coach has actually done that thought process from sort of A to Z. Run it.
Absolutely.
Incredible. Thank you so much, Cory, for coming on. Where can the listeners find you? Although I said at the start,
I have all my inquiries are actually going through Instagram. So if you want to find me at Cory, CORY_FIT, and that is where I am. And I actually am taking very few clients at the moment, just because my roster is full. I mentioned this at the beginning. I'm in nursing school, so the roster is pretty much locked down, but I do offer one-time consults. So if listeners are like, hey, you know what? I got a coach. I feel good about what we're doing. I trust this person, but honestly, I want to look more into the blood work. It's not something they necessarily have that knowledge base. Consults would be something that would be more appropriate. So look at the link in my bio and book a call with me, and we'll go from there.
I can imagine those calls are very, very valuable, but also the content that you're sharing on Instagram is just so valuable. So thank you for taking the time to put it out and be, in my opinion, the leading female educator right now in the industry. So everybody drop her a follow, and if you've got any questions, please let us know, guys. But thank you so much again, Cory, for popping on.
Thank you for your time.
Thanks.
Thank you guys for having me. I appreciate it.